documentation, radiology systems, ancillary systems, and many more. This week we'll be talking about security, information system, and informatic tools to promote safety, patient safety. So when you think about the words privacy, confidentiality, and security, what actually comes to mind? More than 600,000 Facebook accounts are compromised every day. Medical and healthcare has almost 40% of data breaches, and 1.5 million victims of cyber crime are committed every day. So, as you may have heard recently on the news, some healthcare records were hijacked for a ransom in Hollywood at the Hollywood Presbyterian Medical Center, in which they had to pay the hijackers in bitcoins. So at the hospital where I work at, they block inbound emails in a 24-hour period. Shows on the screen that there was 76,000 total clean messages, but there was a total of almost 300,000 inbound email messages which were blocked. Of the 76,000 clean inbound messages, there will still be spam and malware contained in some messages that do not get filtered. This requires that all 10,000 users be trained not to click on links or open suspicious emails, even though some people do. One wrong click can result in a pink slip or expire a virus outbreak. Removing inbound email to even some of the 10,000 email users on a network can drastically reduce our risk. And when we ask the chief information officer what keeps her up at night, she goes, anything that she doesn't know keeps her up. There's just so many security risks that you may not even be aware of that can be a threat. A 2003 nationwide survey by the Computing Technology Industry Association found that human error was the most likely cause of problems with security breaches. The first line of defense is strictly physical. The power of locked door, an operating system that locks down after 5 minutes of inactivity, and regular security training are extremely effective. So, confidentiality is safeguarding all personal information by ensuring that access is limited only to those who are authorized. Shoulder surfing or even watching over someone's back as they work is still a major way that confidentiality is compromised. The most common threats a corporate network faces from the outside world are hackers, malicious code, which includes spyware, viruses, worms, Trojan horses, and the malicious insider. Spyware is normally controlled by limiting functions of the browser used to surf the internet. So what spyware is software that allows another user to track another computer use, whereas a virus is a code that can replicate itself and infect computer and destroy systems. Worms is a standalone malware program that replicates itself in order to spread to other computers. A Trojan horse is a computer program that may steal information or harm computer, which is non-replicating. And a malicious insider is a hacker that inflicts damage to a system. A cookie, even though it looks yum and delicious, and especially heated up in the microwave, is a small file written to a hard drive of a user surfing the internet. On the negative side, cookies can also follow the user's travel on the internet. Spying cookies related to marketing typically do not track keystones to steal user IDs and passwords. They mainly just track where you go on the internet. So security tools. There's a wide range of tools available to an organization to protect the organizational network and information. These tools can be either a software solution, such as an antivirus software, or a hardware tool, such as a proxy server. Email scanning software and antivirus software should never be turned off, and updates should be run weekly and ideally daily. Software is also available to scan instant messages and to automatically delete spam email. So there are different tools out there to authenticate users. Authentication of employees is used by organization in the security policy. Organizations authenticate by something the user knows, like a password, something the user has, like an ID badge, or something the user is, like biometrics, like a thumbprint. Policies typically include the enforcement of changing passwords every 30 or 60 days, biometric devices, including recognizing thumbprints and retinal scanner patterns or facial patterns. Organizations may also use a combination of these types of authentication. So when we look at some of the other security tools like antivirus, this is a computer program that is designed to recognize and neutralize computer viruses. Whereas a proxy server, which is a hardware security tool to help protect the organization against security breaches by preventing users from directly accessing the internet from corporate computers, issuing masks to protect the identity of a corporate employees accessing the World Wide Web, and tracking which employees are using which mask and directing the traffic appropriately. A firewall is also another example of a security tool. A firewall can be either hardware or software or a combination of both. A firewall can be set up to examine traffic to and from the network, so I always imagine a crossing guard. Firewalls are basically an electronic security guard or crossing guard at the gate of the corporate network saying, yes, you can come in, or no, you can't. Then there's use of portable devices that are password protected. Could be a USB, otherwise known as a universal serial bus, which may be a trivia question coming up. VPN, which is a direct access with your computer to the network. Offsite uses of portable devices such as laptop, PDAs, and home computing systems, smartphones, and portable data storage devices can help to streamline the delivery of healthcare. Some agencies had developed a virtual private network, the VPN, that users must log in order to reach the network. The VPN ensures that all data transmitted via the gateway is encrypted. Only essential data for the job should be contained on the mobile device, and other non-clinical information, such as social security numbers, should never be carried outside the secure network. The agency is ultimately responsible for the integrity of the data contained on these devices, as required by the HITECH and HIPAA regulations. So, we'll discuss this online. A community hospital that was preparing for an upgrade, in which a nurse was in the pre-op, wanted to make sure that the history and physical was available for patients who came into surgery after an upgrade in case there was any kind of downtime with the computer. She wanted to put the patient files on her work computer, which was standalone work computer at her office. No one else had access to her computer. Discuss online if you think this is secure enough. The next topic is the electronic health record system. This is a data warehouse or repository of information regarding the health status of a client, replacing the former paper-based medical record. It is a systematic documentation of a client's health status and healthcare in a secure digital format, meaning that it can be processed, stored, transmitted, and accessed by authorized interdisciplinary professionals for the purpose of supporting efficient, high-quality healthcare across the client's healthcare continuum. So some of you may be able to recognize the old chart room, or may even have an old chart room at your hospital if you're not up on electronic health record system. But these were the days where nurses or healthcare technicians may go down and get the old patient's chart. So what is the electronic health record versus the electronic medical record? Well, the electronic medical record is just the paper chart from the MD office or hospital, whereas the electronic health record is the paper chart from both the MD office and the hospital. So in week 2, we talked about the American Recovery and Reinvestment Act, or the ARRA. ARRA. In 2009, again, I'll repeat it, the Health Information Technology for Economic and Clinical Health, the HITECH Act, was signed by President Obama, which gave financial incentive to hospital and providers who demonstrated meaningful use. So this is why it's coming up again, is because we're talking about the electronic health record and why it was such a push to get the electronic health record in hospitals up and running. And we also talked about meaningful use, governed by the ARA in 2009, using the certified EHR to use information technology to increase the quality of care received and improve the safety of care that is provided by the organization. So we'll also go over the different stages. Whereas stage 1, meaningful use criteria focused on data capturing and sharing, whereas stage 2 criteria advanced several clinical processes and promoted health information exchange and more patient-controlled data. And then stage 3 criteria focused on improved health outcomes for individuals, populations, and patient self-management tools. So let's talk about some of the components of the EHR. Some of the essential components of the EHR, as described by the Institute of Medicine in 2003, includes health information data, which is the patient data required to make sound clinical decisions, including demographics, medical and nursing diagnosis, medication list, allergies, and test results. Results management is the ability to manage results of all types electronically, including laboratory and radiology procedure reports, both current and historical. Order entry management, the ability for a clinician to enter medication and other care orders directly into a computer, including laboratory, microbiology, pathology, radiology, nursing, supply orders, ancillary services, and consults. Decision support is the computer reminders and alerts to improve diagnosis and care of the patient at the point of care. The electronic communication and connectivity is the online communication among healthcare team members, their care partners, and patients, including email, web messaging, and an integrated health record within and across settings, institutions, and telemedicine. Patient support is the patient education, self-monitoring tools, including interactive computer-based patient education and home telemonitoring and telehealth systems. Administrative processes are the electronic scheduling, billing, and claims management system, including electronic scheduling for patients and outpatient visit procedures, electronic insurance, eligibility validation, claim authorization and prior approval, identification of possible research study participant, and drug recall support. Reporting and population health management is the data collection tools to support public and private reporting requirements, including data represented in a standardized. When we look at EHR adoption, some of the types of information system are listed here, that we talked about before, which includes the CPOE, the electronic medication administration record, barcode med administration, e-prescribing, clinical documentation, ancillary service systems. And we'll talk about this later when we talk about patient safety. So some of the stakeholders that may be involved in the EHR are consumers, which would be your patients or any other consumers associated with the EHR, nurses, providers, organizations, insurance, and state and national governments. So think about, what are some of the benefits of the EHR? Some of it is the cost of owning that, less paper, access, being able to access the chart from home, from anywhere in the hospital. Also quality, safety, and efficiency. So some of the issues associated with EHR include costs, ownerships, data integrity, privacy and confidentiality, standards, and organizational cultures. The process of becoming a successful owner of an EHR has multiple steps and requires integrating the EHR into both organization day-to-day operations and long-term vision and the clinician's day-to-day practice. The first step of ownership is typically a vendor selection process. EHR certification ensures that the quality product will be selected. Selecting a system based on the organization's current and predicted needs. The criteria should include both subjective and objective items that will cover topics such as a common clinical workflow, decision support, reporting, usability, technical build, and the maintenance of the system. Implementation planning should occur concurrently with the selection process, particularly the assessment of the scope of the work, initial sequencing of the EHR components to be implemented, and so some of the differences between implementation versus upgrade. So implementation is the beginning to make use of a new project. So this is something brand new. It only happens once, and it's usually more costly because it's going usually from a paper system to an electronic system. Whereas an upgrade is going to the next version of the product. This can happen multiple times in a year. For instance, our institution, we do monthly upgrades just so that if there's new products or new enhances, we can push those out to our users. And also with an upgrade, there's usually less resources. You don't have to train as much as you would with the implementation. And also there isn't so much of a big bang theory. So some of the reasons to implement is because of the ARRA, or the American Recovery Reinvestment Act, meaningful use, transition from ICD-9 to ICD-10. This has improvement that we talked about earlier: safety, quality, satisfaction, and access. Here are some of the barriers to implementation, and I'll also be talking about how to help that. So getting started, sometimes people have a difficulty just even getting started. So it's useful to start off with setting a timetable. Not getting buy-in from staff. Make sure that you rely on a steering committee that can help push the agenda and help get people involved. Not getting enough training. Make sure you identify computer proficiency among team members. And also making sure that they attend training. Also, physicians or providers may be difficult. Make sure you involve them in the selection process and throughout the project. And also, you heard of implementation horror stories. So, in the vendor selection, make sure that you look at the product. Ask other hospital and offices if they use the product and what they thought. What are some benefits and disadvantages to using the vendor? Make sure you evaluate cost. Make sure you use some vendor assessment tools. There's many tools out there that you can find on the web. Assess what your needs are for the organization. Schedule site visits. Have the ability to integrate with other products. Especially with a EHR, if you're using some ancillary products, make sure that they have the ability to integrate other products. So here are some type of vendors that can be for the electronic health record system or for other kind of clinical decision support information systems. So there's Epic, Cerner, McKesson, Meditech, Siemens, and Allscripts. So some of the key stakeholders in the EHR would be your chief medical officer, a physician champion, a nurse champion, a project manager, a CEO. What other key stakeholders can you identify that might be helpful? So your implementation team includes trainers, testers, ancillary team members, subject matter experts, EHR builders, nurses, physicians. What are the importance of this diverse team? So when we talk about the system development life cycle, I think we may have touched on this earlier. when we implement anything, whether it's an EHR, any kind of other information system, we want to make sure that we have this development life cycle so it's not just stagnant. So we analyze and think about what we need. We plan, we develop the product, we test it out a lot. Sometimes we have to go back to develop if the testing plan fails. Then we implement, we maintain and evolve and evaluate what's going on. We return to analyze, and it's a continuous cycle. So it's important to note that you're not stuck on one that's always continuous, especially if you're implementing anything new or when you're going back to take a look at what's going on, or even for upgrades. This is very helpful. Some of the risk factors with implementing any kind of system is scope creep, which is when initial resources have budget for and when more enhancements you want to make than originally designed. There's financial risk factors. There could be resources, not having enough resources, software issues, also the big bang buy-in, whether or not you go up with the whole system or just parts of a system. In closing, I really want to point out how important it is to have the electronic record for this and information system is to make sure that we have happy people and that patients are safe, that nobody has to die from a medical error. We want to ensure that the technology system are properly configured and maintained. Routinely monitor and check these systems while making sure that their human potential, the users, are capable of using the systems accurately to avoid errors. And nurses must be involved at all stages of the system development lifecycle. With a focus on safety, safety concerns and remedies need to be analyzed, synthesized, and integrated throughout to have a robust tool that provides meaningful information and enhances patient care while preventing errors and promoting patient safety.